What's up everybody, Dr. Courtney here, and times are a-changin'. This COVID-19 outbreak, which is a sad time for everybody right now, but it's also a time where we all need to get together and be resilient and help our fellow neighbors and kind of start thinking outside the box a little bit. Speaking of boxes, today we're going to talk about what comes in your Invisalign box. And the patient we're going to be discussing, hope he doesn't mind, is my fiance, Matthew Barry. Now, what came first? Was he a fiance first or was he a patient first? Listen, that's a secret I'll never tell, but follow me on Instagram and maybe you'll find out. Anyway, so what comes in an Invisalign box? First, Invisalign has recently rebranded their boxes. They now have a blue cardboard in the front. The old Invisalign box used to be white and look like this, but more or less, it's the same thing. So on your Invisalign box, you have your patient's name here, you have your patient's name on the side, but more importantly, what comes on the inside of the box. So here we go. First thing, they put a little pamphlet about Vivera retainers. To be totally honest, my patients don't normally get this. I throw this away because it's just bulk. And we tell you about this at the end of your treatment. The two important items that you need from this box are the patient's Invisalign trays, as well as this little piece of paper called the Invisalign Treatment Overview. What this tells me as a doctor is, one, where did I program doing some of this IPR on this specific patient? On other treatment overviews, you'll see little blue dots that represent where did the attachments go. So as a doctor, I normally take this out of the box. I don't give it to the patient, but I hold on to this because this is one more reference sheet that reminds me, what did I treatment plan? So when you take your Invisalign trays out of the box, it basically comes in a roll like this. I'm not going to tell you what this reminds me of because it reminds me of Invisalign. So if you're looking at the bag, you can see a couple numbers here. U for upper, L for lower. That means this patient has trays for both the upper and the lower. This is tray number 1 of 15 total trays. So if we're doing the math here and a tray is worn ideally for 7 days each, this is about the first 15 weeks of treatment for a patient, so just under 4 months. So what we usually do is when we give our patients the trays, we normally write the dates in here and we basically add 7 days to every date. So for example, it's Tuesday. I'm going to put today's date, March 24th. For the next one, we're going to put next Tuesday's date, which is March 31st, and so on and so on. So I'm going to set the other ones away and we'll talk about what's in each individual package. So what is it exactly that comes in an Invisalign bag? Quick review: patient's name, patient ID number, U for upper, L for lower, the number 1 to indicate which specific tray is in this bag, and the last number indicates the total number of trays you have for the upper and the total number of trays you have for the lower. This little QR code here, you can easily scan it with the Invisalign app. It's called My Invisalign. Scan this and you can keep track of your tray wear through the app. So it's pretty cool. I personally don't use it because I just put an alert on my calendar. So what's in the bag? You tear the tab, you open the bag like a Ziploc bag, and there'll usually be, if you're doing upper and lower treatment, there's going to be 2 trays in there. One way to figure out which tray is which is you can obviously look at the shape of the teeth. The larger teeth are your upper teeth. The smaller teeth are your bottom teeth. Another way to look at it, look very closely at the fine print. You will see some numbers on the tray. Top number is your patient ID number. This is the lower tray. It says lower, L for lower, 01N for number. So yeah, that's in the box. Typically I will give patients their entire box, but only because I don't have the real estate in my New York City practice to hold all your boxes. That doesn't mean I see you at the end of the box. We will typically schedule patients every 8 to 12 weeks with their Invisalign trays, and they will be responsible for changing them at home every week until their designated appointment. What happens when you're done with the box? Well, it depends on the doctor. For me, can't stop, won't stop, baby. I am going for perfection. And what I like to tell patients is don't let me care more about your teeth than you do, because I will, and I will keep you in treatment. But seriously, so what happens when you get to the end of the box is you come back to our office. We take what's called a refinement scan of your teeth, get a digital model of your teeth, eval where your teeth are now relative to where you started and what we need to design in another set of trays to get you all the way to that finish line. All right, guys, that's it for me for today. As I like to say, go on and share that smile with the world. I'm knocking a lot of these freaking videos out during this quarantine. Can you blame a girl? Stay safe.